Defects of vision and their correction. Sometimes the eye may gradually lose its power of accommodation. In such conditions, the person cannot see the objects distinctly and comfortably. There are mainly three common refractive defects of vision. They are myopia or nearsightedness, hypermetropia or farsightedness, and presbyopia. These defects can be corrected by the use of suitable spherical lenses. Myopia. Myopia is also known as nearsightedness. A person with myopia can see nearby objects clearly but cannot see distant objects distinctly. In a myopic eye, the image of distant object is formed in front of the retina and not at the retina itself. This defect may arise due to excessive curvature of the eye lens or elongation of the eyeball. A concave lens of suitable power will bring the image back onto the retina, and thus the defect is corrected. Hypermetropia. Hypermetropia is also known as farsightedness. A person with hypermetropia can see distinct objects clearly but cannot see nearby objects distinctly. This is because the light rays from a close-by object are focused at a point behind the retina. This defect arises either because the focal length of the eye lens is too long or the eyeball has become too small. This defect can be corrected by using a convex lens of appropriate power. Presbyopia. The power of accommodation of eye usually decreases with aging. They find it difficult to see nearby objects comfortably and distinctly without corrective eyeglasses. This defect is called as presbyopia. It arises due to gradual weakening of ciliary muscles and diminishing flexibility of the eye lens. Sometimes a person may suffer from both myopia and hypermetropia. Such people often require bifocal lenses. A common type of bifocal lenses consists of both concave and convex lenses. Astigmatism. Astigmatism is an irregularity in the overall shape of the eye or the curvature of the cornea. Astigmatic cornea distorts the focal point of light in front of or behind the retina. Diabetic retinopathy. Diabetic retinopathy is also known as diabetic eye disease. It is a medical condition in which damage occurs to the retina due to diabetes mellitus. It is a leading cause of blindness in many countries. At least 90% of new cases could be reduced with proper treatment and monitoring of the eyes. Cataract. Sometimes the crystalline lens of people at old age becomes milky and cloudy. This condition is called as cataract. Cataract often develops slowly and can affect one or both eyes. Symptoms may include faded colors, blurry or double vision, halos around light, trouble with bright lights, and trouble seeing at night. It is possible to restore vision through a cataract surgery. Macular degeneration. Macular degeneration is also known as age-related macular degeneration. It is a medical condition which may result in blurred or no vision in the center of the visual field. The late type is additionally divided into dry or wet forms, with the dry form making up 90% of the cases. Glaucoma. Glaucoma is a group of eye diseases which result in damage to the optic nerve and cause vision loss. The most common type is open-angle glaucoma, in which the drainage angle for fluid within the eye remains open. Open-angle glaucoma develops slowly over time and there is no pain. Less common types including closed-angle glaucoma and normal tension glaucoma. Closed-angle glaucoma can present gradually or suddenly. Conventional surgery to treat glaucoma makes a new opening in the trabecular meshwork, which helps fluid to leave the eye and lowers intraocular pressure. Conjunctivitis. Conjunctivitis is also known as pink eye. It is inflammation of the outermost layer of the white part of the eye and the inner surface of the eyelid. It makes the eye appear pink or reddish. Pain, burning, scratchiness, or itchiness may occur. The affected eye may have increased tears or be stuck shut in the morning. Swelling of the white part of the eye may also occur. Itching is more common in cases due to allergies. Conjunctivitis can affect one or both eyes. Hypertropia. Hypertropia is a condition of misalignment of the eyes. The visual axis of one eye is higher than the fellow fixating eye.
Thank you very much.